Welcome back to Vitalfoliage, your go-to channel for all things health and wellness. Today, we're diving into a topic that affects millions worldwide, but often goes unnoticed until it's too late: the early signs of diabetes. But don't worry, we're here to empower you with knowledge and practical tips to take control of your health journey. So, grab a cup of green tea, sit back and let's get started. Here's a longer and more detailed version of that section. Understanding diabetes, the silent killer. Did you know that diabetes is often called the silent killer? This is because it can develop gradually, often without noticeable symptoms, until serious complications arise. Many people live with diabetes for years without realizing it, allowing the condition to progress unchecked. However, the good news is that early detection and proactive management can make a significant difference in preventing long-term health issues. This occurs either because the pancreas fails to produce enough insulin, a hormone that helps regulate blood sugar, or because the body cannot use insulin effectively. Over time, persistently high blood sugar levels can cause extensive damage to vital organs, including the heart, blood vessels, kidneys, nerves, and eyes. Uncontrolled diabetes significantly increases the risk of heart disease, stroke, kidney failure, vision loss, and even limb amputation due to poor circulation and nerve damage. The three most common types of diabetes are type 1 diabetes, type 2 diabetes, and gestational diabetes. Each type has distinct causes, risk factors, progression patterns, and treatment approaches. Type 1 diabetes is an autoimmune disorder in which the immune system attacks insulin-producing cells in the pancreas. Type 2 diabetes is the most prevalent form, and is primarily linked to lifestyle factors, such as poor diet, obesity, and physical inactivity. Gestational diabetes occurs during pregnancy when hormonal changes cause insulin resistance, leading to high blood sugar levels. While it usually resolves after childbirth, women with gestational diabetes have an increased risk of developing type 2 diabetes later in life. Understanding the distinctions and similarities between these types is essential for individuals at risk, as it allows for better prevention, early intervention, and more effective management strategies. By making informed lifestyle choices, staying physically active, and undergoing regular health checkups, individuals can take proactive steps to reduce their risk and maintain long-term well-being. Types of diabetes. 1. Type 1 diabetes, previously known as juvenile diabetes or insulin-dependent diabetes. Type 1 diabetes is a chronic condition in which the pancreas produces little or no insulin. Insulin is the hormone needed to allow sugar glucose to enter cells and produce energy. The exact cause of type 1 diabetes is unknown, but it's believed to be a combination of genetic susceptibility and environmental factors that trigger an immune attack on the insulin-producing pancreatic beta cells, but it can develop in adults as well. Treatment. Type 1 diabetes requires a comprehensive management plan, including insulin therapy, diet adjustments, and lifestyle changes to maintain normal blood sugar levels. Type 2 diabetes is far more common, accounting for 90% of all diabetes cases worldwide. It typically develops in individuals over 45 years old, but due to rising obesity rates, a growing number of younger people, even children, are being diagnosed. Cause: the body either resists the effects of insulin resistance, or doesn't produce enough insulin to regulate glucose levels. Unlike type 1 diabetes, type 2 diabetes can often be managed and controlled with lifestyle changes alone in the early stages. Treatment. Dietary changes, regular physical activity, and maintaining a healthy weight can significantly improve blood sugar management. However, as the disease progresses, medications and insulin therapy may become necessary. 3. Gestational diabetes. Gestational diabetes occurs during pregnancy when hormonal changes make the body unable to use insulin effectively, leading to elevated glucose levels. This type of diabetes typically resolves after childbirth, but it increases the risk of developing type 2 diabetes later in life for both mother and child. According to the World Health Organization (WHO), in 1980, 108 million adults were living with diabetes. By 2014, this number had soared to 422 million. Diabetes is a major cause of blindness, kidney failure, heart attacks, stroke, lower limb amputation. Preventive measures, such as screening for prediabetes, promoting healthy lifestyles, public health campaigns and policies that focus on reducing obesity and encouraging physical activity, play a vital role in combating type 2 diabetes. Recognizing the early signs of diabetes. Diabetes often develops subtly, making it easy to overlook the early warning signs. However, recognizing these symptoms early can be life-saving. The signs of diabetes vary by type, but common symptoms include symptoms of type 1 diabetes. Type 1 diabetes symptoms develop rapidly, often over a few days to weeks, and are severe enough to prompt immediate medical attention. Excessive thirst and frequent urination. High glucose levels pull fluid from tissues, making you thirsty and increasing urination. Extreme hunger. Without insulin, your body lacks energy, leading to intense hunger. Unexplained weight loss. Despite eating more, you lose weight because the body burns muscle and fat for energy. Fatigue and irritability. Deprived cells cause low energy levels and mood swings. Blurred vision. High blood sugar affects the lenses in your eyes, making it hard to focus. Symptoms of type 2 diabetes. Type 2 diabetes develops slowly, making it hard to detect. Symptoms include yeast infections. High sugar levels create the perfect environment for yeast growth. Slow healing sores. High glucose impairs the body's healing ability. Frequent infections. The body's immune system is weakened by high blood sugar. Pain or numbness in feet or legs due to nerve damage. Diabetic neuropathy. Symptoms of gestational diabetes. Gestational diabetes is often diagnosed through screening, but symptoms may include increased thirst and urination. Diabetes, prevention and management. While type 1 and gestational diabetes are not typically preventable, type 2 diabetes can often be prevented or delayed through proactive lifestyle changes. How to lower your risk of type 2 diabetes. Maintain a healthy weight. Each kilogram of weight loss can reduce diabetes risk by 16%. Stay active. At least 150 minutes of exercise per week can reduce diabetes risk by 58%. Eat a balanced diet. Focus on whole grains, lean proteins, vegetables, and fiber-rich foods. Monitor blood sugar. If you're at risk, regular blood sugar checks can help detect changes early. Managing diabetes through diet and exercise. Even if you develop diabetes, lifestyle changes remain key to managing the condition. Control carbohydrate intake to maintain stable blood sugar levels. Exercise regularly to improve insulin sensitivity. Avoid sugary beverages and processed foods. Diabetes is a serious condition, but knowledge is power. Recognizing the early signs, making proactive lifestyle changes, and seeking timely medical advice can help prevent complications. If you experience any symptoms, consult a healthcare professional immediately. Stay informed, stay healthy. Don't forget to like, share and subscribe for more health and wellness updates from Vitalfoliage.